Dr. Rafich here from Vet Triage. Sorry for the weird background. I am in a hotel in Los Angeles. We are going to go through this issue of JAVMA here, May 15, 2014, and we are working on the Theriogenology question of the month. A 12-year-old nulliparous American paint mare showed signs of colic following natural breeding. Blood was detected on the stallion's penis at dismount, and the mare was seen to intermittently pass hemorrhagic vulvar discharge. Gross. On physical exam, the mare showed tachycardia and hemorrhagic vulvar discharge with blood clots and blood staining in the tail hairs. Vaginoscopic examination revealed a large laceration with tearing in the right dorsolateral wall of the cranial portion of the vagina, full thickness perforation of the vaginal wall. They performed a transabdominal ultrasound and abdominocentesis. The complete blood count of the mare showed neutrophilia with a left shift. Fibrinogen concentration was elevated. The abdominal fluid sample showed white blood cells with non-degenerate neutrophils, scant hemorrhage, and the presence of foreign material. And so you can see in the picture here, this is the abnormal cell here, and they say abdominal fluid obtained from the mare with colic and hemorrhagic vulvar discharge. So the answer is Seminoperitoneum or seminal peritonitis, secondary to full thickness vaginal laceration that occurred during natural breeding. So they treated the mare with isotonic saline, penicillin G potassium, gentamicin, flunixin, meglumine. They performed surgery under detomidine hydrochloride and butorphanol tartrate. They did a caudal epidural anesthesia, lidocaine hydrochloride, and xylazine hydrochloride. Laceration was sutured. A 32 French abdominal lavage tube was placed percutaneously into the abdomen. They applied mineral oil via a nasogastric tube to provide laxative effect. Abdominocentesis was repeated 6 days later after surgery, and fluid samples were submitted for bacterial culture and cytological evaluation. White blood cell count decreased. They cultured Klebsiella pneumoniae, subspecies pneumoniae, and they started giving enrofloxacin based on the culture results. So, let's see. Here is a picture of abdominal ultrasound that was done afterwards, and they're pointing there in that line to the suture line in the vagina, and then here is the same cytology with an arrow showing that there's sperm in the white blood cells. Discussion. Possible sources for vulvar hemorrhagic discharge include varicosities, trauma, hematoma, urinary tract hemorrhage, and a recent history of breeding activity and acute onset of hemorrhage would suggest breed-associated trauma as the likely cause. Vaginal trauma during natural breeding is infrequent in horses because the vagina stretches during coitus. Vaginal injuries are often superficial with mild lacerations to the mucosa and submucosa of the cranial portion of the vagina and cervix. A breeding roll is sometimes used during matings involving large or vigorous stallions to limit the extent of penile intromission. Other sources of vulvar hemorrhage include disruption of the hymen in virgin mares and vaginal varicosities. Although vaginal trauma is rare, a full thickness perforation that communicates with the abdominal cavity is a life-threatening condition because peritonitis will develop and eventuation may occur. The ejaculate of stallions is not sterile and contains bacteria in addition to seminal components. Superficial lacerations of the vestibule and vagina may heal without treatment. The risk of adhesion formation is great with any vaginal injury. Adhesion formation can range from minor filamentous web-like strands to severe transluminal adhesions that may substantially limit reproductive capabilities. The latter may also predispose a mare to chronic endometritis and fluid accumulation in the uterus. In mares that do not have full thickness lacerations, application of corticosteroid-containing ointments to the vaginal wall may reduce the incidence of adhesion formation. However, corticosteroids could interfere with healing of a full thickness defect and application of steroids should be delayed in mares such as the one in this present report. Long-standing lesions and those that cannot be readily sutured are allowed to granulate and heal by second intention healing. Regardless of the treatment, the mare should be cross-tied for at least 3 to 4 days to prevent recumbency and minimize the risk of eventuation. Surgery with the mare in a standing position is the preferred method because of concerns of increased risk of evisceration during recovery from anesthesia. Additionally, with a mare in a standing position, the abdominal viscera can move ventrally, which increases the ease of access within the vagina compared with that for a mare in dorsal recumbency, with the weight of the viscera compressing the vagina. After the vaginal defect is sutured, a Caslake vulvoplasty procedure may be performed to minimize pneumovagina, which may cause the mare to strain as a result of irritation to the vaginal mucosa. Mares may also benefit from fecal softeners, like oral administration of mineral oil, to minimize straining during defecation. Abdominal lavage following surgical correction of a full-thickness vaginal laceration will decrease the severity of peritoneal contamination. Pathogens that may be found on the penis of a stallion include Staphylococcus species, E. coli, Streptococcus species, Proteus species, Klebsiella species, and Pseudomonas species. Additional possible complications that have been reported following breeding accidents include abscesses and intra-abdominal adhesions. Intra-abdominal adhesions can cause future episodes of colic. So that's it. So in dogs, a common source of confusion among doctors when you're performing a rectal procedure or perineal procedure and you're afraid of them straining every time they want to poop is you start them on a low residue diet. A low residue diet means that fecal output will be minimized when they eat, and that way they're not pooping as much, and that'll prevent straining. Otherwise, you can do what they did here in dogs, where you can give stool softeners, basically try to purposely create diarrhea. The problem with having too soft of a stool is that can also cause them to want to strain as well, and that urgency to go is the problem. So that's one method. Those are two methods of trying to minimize irritation for rectal surgeries or perineal surgeries in dogs. I imagine in horses you can't really change their diet too much, so mineral oil application is the way to go. But crazy case. All right, thanks for supporting this channel. We'll see you in the next one. Bye-bye.